actually have a master's degree in English language and literature, which is a little bit unusual for being a veterinarian. Had a bunch of different jobs and was looking taught high school for a while and did a few other things, and then finally I just realized it's like, look, this is what I really want to do. In college I'd been a little intimidated by some of the sciences, looking at chemistry, the classics that everybody really worries about, and then I just decided this is what I really want. This is how I'm going to go about it. So I took the prerequisites necessary and applied to school, and here I am. I think people going to vet school, initially they imagine that vet school is the end of your education. I really look at it as the beginning of your education. For me, when I finished school, I didn't feel that I was done. I knew I wanted to work on horses, so I applied and obtained an internship at Louisiana State University for a year. It was a 1-year equine medicine surgery rotating internship. And very quickly there, I realized that I wanted to be a horse surgeon. So at that point, I applied through the match for residencies. And this is a kind of classic story. I did not get a residency, but obtained a 1-year fellowship at Oregon State. Moved all the way from Louisiana to Oregon. And then within about 10 days of being there, I was offered a position as a resident in California at UC Davis. So, and that happens all the time. Happenstance, some odd circumstances will allow you to go in different directions that you didn't know were going to happen. So I spent 3 years in California at Davis doing a surgery residency to become a board certified large animal surgeon.
In this clip, Dr. Eddy is desensitizing the horse. This technique allows the horse to get used to being touched by the tool and other tools she's going to be using. She is testing or scanning various acupuncture points by applying pressures to them and then gauging the sensitivity and reaction of the horse. You may notice him jumping slightly as Dr. Eddy starts to scan points towards his hind end. There are approximately 365 acupuncture points for the horse, as you can see depicted here in this image. These points run along 12 main meridians, which are essentially invisible channels which qi circulates throughout the body.
Mo is a 7-year-old quarter-horse gelding. He is here today for a second in a series of acupuncture treatments. He has a tear in the deep digital flexor tendon in his right forelimb. He's been treated with multiple treatments, including rest and increased physical therapy at home, mainly walking, but some stretching exercises, passive range of motion. He has gotten injections of autologous conditioned serum into the defect in that tendon. We have done 3 treatments using the shock wave. The acupuncture is being given in conjunction with laser therapy to help improve his comfort level, to promote healing of the tendon, and also to treat some other old orthopedic injuries this horse has. The owner told us that he has injuries, particular arthritis in his hocks and his stifles, in addition to treating the issue that he presented for, which is the tendon injury. We're going to use acupuncture to help treat the whole horse and pay attention to other things. All right, so we're going to use multiple acupuncture points. The first one has a Chinese name. It's called Ai. This is one that's commonly used in many horses, called a permission point. Most horses aren't going to mind this. If they tell you, hey, I really hate this, then that horse may not be a great candidate for doing acupuncture. So he's going to pay attention, but he's not objecting, so he's good. Some reaction. That tells you that that's a response of some type, where they're twitching or moving their muscles, or sometimes licking their lips, or even blinking, telling you that they probably needed to be treated in that area. He didn't really respond on this side, but he did on the left side, which is kind of interesting because he appears to be more sore on the left than on the right. The Chinese have a very elaborate explanations for why this works based on a lot of history, philosophy, and theory of disease. which is very different from the Western concepts. For Western medicine, there have been a lot of evaluation of this to see if it works.
Are most of your landmarks skeletal landmarks or muscular landmarks?
Both. That's a really good question. Some of both. So a lot of them are going to be based on skeletal. For example, right now, this is a point. This one is called ladder 18. And it is actually has two. This is a little odd. It has two locations: 18, 17, 16, 15, 14. I'm counting rib spaces. It's 14 rib spaces, and it's going to be 6 finger widths from his midline, and this is also here, so it's in his 13th and his 14th rib spaces. So there's a little twitch right there, not much, but a little bit. That's one thing that I didn't really think about so much when I started. I'd always imagined that it would be very useful for musculoskeletal injuries, and that's a big reason that I started as a horse surgeon and someone who treats a lot of lamenesses and injuries. To me, that was kind of an avenue in. I'm going to treat pain. I'm going to, maybe promote blood flow to a certain body part of a certain organ system to help promote healing. However, through taking the course, I really realized how many different types of illnesses could be treated with acupuncture. Use it for endocrine diseases, really natural fit for neurologic disease. If you think about, brain injury or spinal cord injury, using acupuncture, a lot of what we're doing is probably stimulating nerve endings and affecting the neurologic system. So that's been very interesting. I treated one of my own cats recently for a liver disease. He had a cholangiohepatitis, which is a liver infection. And yes, he was on antibiotics. Yes, he was on other medications, but I used acupuncture to help him recover from that disease. So it's been very interesting. I've never thought of using acupuncture for cancer, but it's not going to make tumors go away, but it can certainly slow the progression of certain tumors and also help the animal be more comfortable as they're fighting cancer. Something I'm certainly not going to quit using my Western tools. I look at acupuncture and the other therapies as additional tools to help treat patients. It's part of the whole. It's not the whole. A lot of Western medicine is very quick. I inject steroids in a joint within a week or two. Usually that animal's going to feel better. The Eastern philosophy toward medicine is you're going to maybe take a little more time, maybe use the body to help heal it, maybe a little slower, but you're going to restore balance to that animal to help them recover. So this is getting him ready for electrical acupuncture. And this is just gonna augment or kind of intensify the activity of the needles. The colors are not different from each other. They just help me figure out where the wires are going. So it's going to be help that way. I'm sorry, Betty. As far as you're creating electrical stimulus in the tissue to help with pain. And it's gonna, many therapies, what they're doing is they're gonna increase blood flow to the injured areas, try to bring in growth factors, and promote healing. Just try that and set my timer. I'm typically gonna do this for about 10 minutes. Tissues.
Do you do 10 minutes total, or do you increase intensity and do another 10-minute segment?
10 minutes total, but there's certainly, you could go for longer. There's no magic. But what I'm going to do is throughout the 10 minutes period, I'm going to increase the intensity. So see, he's getting a little bit of response. He's like, something's happening. He's a little more alert now. He's opening eyes, but nostrils a little bit. He's not objecting, but he's attentive. So we're going to go slowly. Oftentimes we'll actually get them to the point where they see a little bit of muscle fasciculation, and I want them to just where they're starting to see fasciculation. I don't want much higher than that. And I won't keep that the full time period. I'll get them to fasciculate, then I'll turn them down for a few minutes, and I'll turn it back up and cycle that through a couple times. acupuncture on the dog as well. It's a really great modality. It can be used on pretty much any species, but primarily here we've been doing it on horses and dogs, and I have done my own cat at home. This is Roscoe. He is a lovely creature. As you can see, he's a 13-year-old beagle, and Alexis here is his owner. She also happens to be one of our veterinary technicians.
He's now 13, and I have been very interested in acupuncture for him, just to help him stay comfortable as he's aging, and to help him have more energy.
So far we've done 3 treatments for Roscoe at about 2-week intervals. It's been about 3 weeks since the last one. And Alexis, tell us what you think. Has he seemed like he's changed any since the acupuncture started?
Yes, he seems much more energetic, likes to get up more and run around the house. I think he takes stairs better, and is just more willing to go.
For me, the best assessment of improvement is often what the owners perceive at home. So to hear that he is happier at home and moving around more, to me that means that we're going in the right direction, and we've probably helped him some. And he's kind of entering the maintenance phase where I'll probably treat him once a month, once every 6 to 8 weeks, just to try to continue to keep the comfort level that we've achieved so far.
Why don't we check points like we do in horses on dogs?
It's a little bit different. The dogs, they don't frequently do the scan that they do in horses, but some things that you can do, you can certainly do assess their tongue color. So we'll take a peek at his tongue. Hi, buddy. His tongue actually looks pretty good. It should be, got a little bit of dental tartar, but his tongue is a pretty classic peach flower pink, which looks pretty normal. If their tongue is purple or pale or swollen or real dry, that can be indications of problems in Chinese medicine. In horses, we'll evaluate the pulses and the carotid artery really low, close to their shoulder, but in the dogs, we can try doing it in his femoral arteries, so it's a little bit different. Palpate his pulses.
Do you feel like he was as receptive as he is now during his first treatment?
This dog, yes.
Okay.
Not all of them are. He's just a super sweet, kind, very relaxed dog. So he was like, sure, needles, no problem.
Mm-hmm.
Other dogs, and particularly horses, are a lot more skeptical the first time. And even the ones that cooperate, they're a little more concerned about the process. He's never really been concerned. Rather than doing the scanning that you do in horses, using either a pen or a needle cap or something, you can do a palpation to check for areas of the sore. You can also palpate for areas of heat. He's got really good range of motion. Let's check his little hind. Maybe just the tiniest stiff in extension here, but really pretty good, and a little less stiff than when we started. So with the horses, we use what's called a permission point back here towards their pelvis. And the dogs, the permission point is in a different location. This one's called GB14, and this is going to be up by between his ears, right over the top of his head. There we go. And just like the horses, it's a method to find out, is this particular animal going to be receptive to acupuncture? And he's like, sure, no problem. But it's a nice place to start. And in the hindquarters, we're going to use a lot of points to have an effect on his pelvis, on his hips, on his his stifles or his knees, as they would call it in humans, which are very common points for stiffness and soreness. In addition to helping particular areas or regions of his body, the treatment is also going to help release endorphins and just establish or promote a sense of general well-being and comfort by the endorphin release as well as potentially stimulating nerve endings to have response in the area where the needles are being put in. And you can see this dog is very relaxed. Like the horses, a lot of the points are found by referring to anatomy. I have some twitching here. That's involuntary twitching. That's as a response from the stimulus. And he's a little alert, but he doesn't seem to mind it too much.
Are there any side effects that owners can expect from acupuncture?
That's a really interesting question. That typically, for example, the horses, we will ask the owner not to ride or work the horse the next day because a lot of times the animal will be very relaxed. This dog previously, he's been actually had to kind of ask him to get up after his electrical treatment because he's so relaxed. And that's the main side effect, is to make sure that the animal has a day off if they're in active work, in order to let them kind of feel the full effects and to recover before. There's a small potential, very, very, very small potential anytime you put a needle into an animal for an infection. I have not seen that, and that tends to be very, very rare. Boy, there are a lot of things I really like. I like seeing the animals respond, even when especially when I haven't been doing that long. How is this treatment going to work? Is it going to make the animal feel better? And one of my favorite cases, I helped treat a very sick calf that had diarrhea. It was very stunted, had diarrhea, and had severe pneumonia. And they asked if I'd be interested in treating. I said yes, absolutely. And then actually the client had asked if the acupuncture be performed. The calf was breathing very heavily, really struggling for air, and pretty miserable. I worked up a protocol. I'd never done cattle before, so we'll extrapolate from horses. They're not the same, but we can use what I know and pick some points and treat the calf. And like immediately after I treated this little calf, he started taking big, deep breaths. And the students he's not done this before. He's been here for 3 days, and we've never seen him relax, and we've never seen him take these breaths. So seeing the results is very gratifying.